So you mentioned headaches and migraines. So many people struggle with that. And you mentioned you'd get adjusted and help for a little bit through chiropractic, but it wouldn't kind of last long. But until you
Mhm,
dealt with these meridians. So what
mhm.
meridians were off in this way that allowed that adjustment, that realignment to hold um,
Mhm.
sustainably for you?
Yes, headaches, anytime a person comes into the clinic that says they have a migraine or a recurring headache, I always tell them to get their gallbladder checked or their small intestine for SIBO. I know that's something we talk about a lot in our conversations with our clients and patients, but the meridian for me was the gallbladder. And the gallbladder channel, if you guys can imagine this, if you're listening, it starts at the corner of the eye on both sides. And the second point goes to where? Your TMJ.
Mhm.
So if you have tight jaws, TMJ, grinding at night, you wear your teeth out because you're clenching at night, that's the gallbladder. The small intestine meridian is only a body inch up from that. So if you get pain around the ears as well, because those two meridians wrap around the ear, jump back up to the forehead, and then they go right back down the sides of the neck.
Mhm.
So anytime a person has a chronic migraine or headache, they're going to have that association with their upper digestion. And that was me, brother. I literally drank Coca-Cola and ate Frosted Flakes. I don't know how much. I ate toaster strudels like they were going out of style. And for me to think like I'm going to have a good gallbladder, I'm not going to have a good gallbladder. For you guys out there, you listening and laughing, going, that's me. When I had that, it dehydrated my gallbladder so bad that the energy that should have gone out from the sides of my eyes, down through my jaw, around my head, should have gone all the way down to my feet. But my gallbladder was so sick that it said, hey, I need more electrical energy because I need to repair. So it stagnated the chi in my meridian to keep it there.
Yeah.
And so what happens? Inflammation in my head. I get too much histamine response. Now everything I eat is causing me to have a histamine response. And so I was having this headache. And then in response to the sympathetic tone of my body, which was getting high alert, the little areas around your vagus nerve, remember, guys, it goes right beside your carotid, right? If you have that vagus nerve getting irritated, it will cause small muscle contractions and shifting around your neck. And you're always going to have one or two places in your neck that goes, oh, the doctor and the chiropractor always hits this spot every single time, all from my nutrition, all from my digestion. And those are the two spots. The other spot was my colon. I had some chronic diarrhea with constipation, and that large intestine meridian goes right down the sides near my Adam's apple, along with the stomach. So, all that to say, without getting boring, guys, is that whenever I had a migraine, I was then pointed to all my digestion because all those meridians go right through my neck. So, please don't think that, oh, I just slept wrong. Brother, you know, when people always say that to you, they're like, oh, I just slept wrong. We're like, I agree. I really, really am very glad you think of that, but mostly it's going to be your digestion.
Yeah, for sure. No, this isn't boring at all. I know people are loving this because it's this sort of clinical breakdown is I what I wanted to get out of our conversation. So thank you for this. The okay, so did at that point, or even for how that you work with people now, what would be the approach here? Acupuncture and explain to people. I mean, we're talking about fascia and how the needles work, or acupressure. Are you a fan of that with these
I love
specific
it.
points?
I love it. I think that you're right. I think you should go structure with some biochemistry and nutrition and definitely emotional work. In a nutshell, the fascial system, when it gets bound up around the base of the neck and the skull, right in that area, and especially the upper traps. If you guys out there have headaches with upper traps, the gallbladder 20 is a main point right there in the gallbladder 21, and it's going to be bound up. So the fascia needs to be released with acupuncture, acupressure. Quick observation about how it works. When your fascia binds up, that electrical signal is trying to travel smoothly through the fascia. But if those acupuncture points get bound up, the fascia around it contorts and it almost wraps like saran wrap. You ever done that? You wrap saran wrap and it just gets bound up.
Mhm.
That's what your fascia does. And so the electrical signal is trying to move through that area of the body and it can't because the fascia is so bound up
Mhm.
because the stagnation of the energy from the organ. So you have to take a needle and stick it in the fascia at the right angle. They call it acupuncture, putting it at different angles. And this is a beauty. If you put a needle in a certain angle, what it's doing is a couple things. It is etching that needle into the right, correct angle to bring chi through the point because it's using that little needle like a lightning rod. It's using it like a grounding rod. using that energy and passing to the other side where the block is at. It also acts as an antenna to the environmental energy that's in your biofield, and it's allowing your body to extract the frequency that's needed. And that's the beautiful thing of our body, right, brother? It's like you literally are taking the environmental frequencies, and your body knows which one it wants to attract. And the master acupuncturist can come up and put it at the right angle and say, that's it. And it puts chi right into that point, breaking the block. So when you do that, I always say get acupressure, acupuncture. Go treat the gallbladder. When I then go into biochemistry, I say, I'm going to do everything I can to help you with herbals or supplements, changing your diet to cleanse your gallbladder or your small intestine. So it means cutting out sugar, corn syrup, high fructose, anything that's simplified sugars or simple sugars, and going into a more whole food diet. But one of the most important things is, how do we cleanse the gallbladder when it's so diseased? When you're drinking plenty of water, you're making sure that you cut out all the refined sugar. I use different types of herbals, such as phyllanthus, which is stone breaker. It's a stone breaking type of herb. So guys, look at phyllanthus, or one called Bodyguard Supreme. I'm not promoting anybody. That's one good one. Or Schisandra. Everybody loves Schisandra, milk thistle. These are the ones that actually create a lot of help in breaking up those stones by producing glutathione. So I tell patients the acupressure, the pills of Schisandra. And when you combine those, you're going to naturally unwind the fascial system. People are going to actually naturally unwind, because when you take pressure off the gallbladder and break up the stones in the gallbladder or the sludge, it's going to release chi to go right through those points. And all those little stagnant points on the sides of your neck are going to be relaxed and relieved, and you'll stop your belching and your burping and your floating stools, which are all signs of gallbladder issues. But I want you guys to think about this.